So I'd like to introduce our two guests tonight. We have Dr. Devon Christie, medical doctor. She is a clinical instructor with the UBC Department of Medicine and has a focused practice in chronic pain and trauma. She's also a registered counselor emphasizing relation-somatic therapy, a certified mindfulness-based stress reduction teacher, an interpersonal mindfulness teacher. She's trained to deliver both MDMA-assisted therapy for PTSD through MAPS and ketamine-assisted psychotherapy, has been certified with the Institute for Functional Medicine. She's passionate about educating future psychedelic therapists on trauma-informed relational somatic skills and is co-founder of the Psychedelic Somatic Psychotherapy Training Program. She also teaches for the California Institute of Integral Studies, certificate program in psychedelic therapy and research, the Integrative Psychiatric Institute certification program in psychedelic assisted therapy, and the ONCA Foundation Psychedelic Therapy Program. She's currently principal investigator and study therapist for a Canadian MAP-sponsored open-label compassionate access study investigating MDMA-assisted therapy for PTSD, and co-investigator on a study investigating MDMA-assisted therapy for fibromyalgia. Devon is a recognized speaker and expert on the potential for incorporating psychedelic-assisted therapies in an improved healthcare model for the future, and is a medical and therapeutic service director with Numinous Wellness Incorporated. Dr. Will Siu, medical doctor and philosophy, completed medical and graduate school at UCLA and the University of Oxford, respectively, before training as a psychiatrist at Harvard Medical School. He remained on the faculty at Harvard for 2 years prior to moving to New York City to further pursue his interest in psychedelic medicine as a practitioner and public advocate through speaking, writing, and social media. Will is an advisor to Bexon Biomedical and People Science. He, along with Devon Christie and People Science, is preparing a pilot study for MDMA-assisted psychotherapy for fibromyalgia. Will has been trained by MAPS to provide MDMA-assisted therapy and maintains a private practice in Los Angeles where he provides individual psychotherapy and ketamine-facilitated psychotherapy. He approaches his work with the goal of lasting patient-centered healing, using his skills and expertise to help his clients find healings within themselves. He teaches and supervises therapists and psychiatrists as part of his clinical practice. My name is Michael. I'm your host this evening. I've had chronic pain issues for over 25 years now from ankylosing spondylitis. So with that, I'd like to get started. Though we have two very incompetent and expert medical doctors, content discussed is not intended to be a substitute for professional medical advice, diagnosis, or treatment. You should always seek the advice of your physician or other qualified health provider with any questions you may have regarding medical conditions because they actually know you. So, hello, Dr. Louis and Dr. Christie, or Devon and Will. Thank you very much for coming out tonight.
Oh, thank you so much. It's a pleasure to be here. And I wanted also just to, because I know Will really well, just his pronunciation of his last name is Siu, S-I-U. But I wanted to thank you, Michael, for the introductions and your land acknowledgement and all of the resources that you're sharing and the intention of the Portland Psychedelic Society. Just thank you so much for all of the work you're doing.
Thank you very much. I appreciate it. And I'm sorry I butchered your name, Will.
Okay. Will is just fine. So yeah, right. Thanks for having us. I'm excited, and I encourage anyone who wants to also join on the camera. I love engaging and seeing faces. So
cool.
Wonderful.
Thank you. Can you both tell us kind of how you both started in getting into the psychedelic fields and pain management and that kind of stuff? Whoever wants to start is fine.
You want to go ahead, Devon?
Okay, sure. Thanks. So it's been an interesting journey for me. I think even just entering the field of medicine was this bit of a roller coaster from thinking that that's what I was going to do from a young age, probably from parental influence, to then railing against that, and then realizing that actually studying life is what I'm most passionate about. And I didn't see a different path that would allow me to like really learn that stuff than sort of angling to medical schools was in high school. And but I had a period of being unwell in my late teens and early 20s with anorexia and bulimia, and also started practicing yoga kind of by fluke at that time, as part of a perfection project. And a long story short with that is that I realized kind of by sort of the end of my undergrad, that medicine wasn't everything that I thought it was, and that I was actually harmed, and as were some other women, in a study I did in my undergrad on medicalization of body image and eating related issues by the words and attitudes of doctors. So I kind of got mad, and then also got this conviction that rather than going to where I felt more philosophically oriented, which was naturopathic medicine, that I would enter the system that I saw as really needing some change from within, and also with the desire to understand better why, you know. And definitely, I have so much compassion for physicians. I wanted to drop out of medical school a few times in my journey there. Medical training is quite traumatic, actually. And I won't go into that more, but it definitely opened my eyes. So came out the other side, chose family medicine because it was broad and resonated with a lot of my values, and was also the quickest way out. And started practicing in rural British Columbia, where I live, and found other communities of resonance. So like you mentioned, I studied with the Institute for Functional Medicine, which is a more systems biology approach to understanding health and healing and illness. So that was sort of got my juices flowing again. And then, with this history of yoga, and actually how it had become quite a pillar for my own healing journey, I really wanted to, in some way, offer that to my patients. And I found John Kabat-Zinn's program, MBSR, Mindfulness-Based Stress Reduction, which includes mindful movement, yoga, meditation, as a evidence-based program to offer. So trained in that. And then kind of around that time was when I got exposed to psychedelics, quite academically, really. I went to a conference where one of my dear mentors and colleagues and friend, Dr. Gabor Mate, was presenting. It was his name on the bill that drew me to the Spirit Plant Medicine Conference in, I guess it was October 2011, and learned about ayahuasca and the work he was doing with people with substance use disorder, and was just like, how did I not know about this? I want to learn more. I want to experience this. And met him, and eventually in 2012 had some experiences with that medicine, quite a few. And I traveled to Peru and did some actually the shamanic yoga teacher training program in Peru, which was amazing. And kind of in parallel to that, learned about the work of MAPS and their work with MDMA and PTSD. And around that time as well, I was learning that just teaching mindfulness isn't necessarily helpful when people have a lot of trauma in their nervous system, when there's survival energy that's circulating and trapped. If you ask somebody to sit still and observe that, it's actually quite uncomfortable. Like, it's actually, I didn't even think it was ethical, really, when I really realized that, that's what we're asking people to do who have a lot of trauma. And so that's why I wanted to learn more about trauma therapy, and led to my relational somatic trauma therapy learning. And so that kind of coincided. I kind of did that because I was so inspired by the MAPS preliminary data, and really thought, I need to direct my life towards making this happen in the world. And I felt also, as a family doctor, not really equipped to be a therapist for people with severe PTSD in the MAPS studies. So I felt it was incumbent on me to get that extra training as well. So did that, and then became trained as one of the therapists for the phase 3 Vancouver site, of the MAPS work. And ultimately, actually, that got delayed, and I went away and came back, and I'm now re-engaged with MAPS. But that's kind of been my journey. I like to, it's kind of like going down this rabbit hole deeper and deeper. And each layer has just been more tools that actually have the potential to help people with even more suffering. And of course, I've had my own parallel healing journey, and Will and I are so much aligned in our lives and how we live and how we work, that it's we're always doing our own work. That's a never-ending journey. But I'll stop there. That's, oh, and actually with pain, pain, last thing, because you asked about pain.
Yeah.
I focused my practice in chronic pain in I think it was 2015. Just because just the practice of family medicine is a lot of guideline following and a lot of drug prescribing. And I just felt all of my skills that I was building were really lent themselves well to chronic pain. And chronic pain is such a mind-body connected field. And I also had experienced chronic pain from a young age. I have had chronic low back pain and a number of different injuries that I've experienced and kind of healed through. So that's what led me into the chronic pain field.
Great, thank you. Yeah, that I can definitely relate to what you said about doctors and kind of the labels that they give you and how that affects you. And also just being kind of mistreated by the medical community in general. So yeah, I can definitely understand that. And especially I can definitely relate, to what you said about trying to push mindfulness onto people who are in such a horrible mind state that it really is, harmful almost. When I would try to do the body scan meditations, when I would get to my heart, I would start to have palpitations, which would only make me more anxious, and my blood pressure would shoot up. And it was just the only way I could do it was to kind of do a workaround and start with visualization meditations. And once I calmed my body down, then I could start to incorporate mindfulness. But if I went straight into mindfulness, it was like everything went into overdrive. So yeah, I can attest to that. Will, please tell us your story.
All right, hello again. So yeah, no, I just love hearing. That's the most complete of Devon's story that I've heard, which is really wonderful. So let's see. So I don't know, I like, for some reason, age and time always feels like a comfortable place to start for me. So I'm 41, and at 32, I had just finished my internship, which is, for those who don't know, it's my first year of training after receiving a medical degree that a doctor does. And I was at Harvard in Boston, and yeah, it's really known to be sort of the most difficult year in general for most doctors. You're working like 80, 100 hours a week for an entire year. And it's kind of like one of those, yeah, you've just got to go through it sort of things. And and I hit like actually, but initially I was excited because I'm like, okay, I got this really difficult year done, but now I'm starting this, my calling, psychiatry. And then in one of our first lectures of the psychiatry part of the training, within a few months of finishing the internship, we had a lecture on depression medications. And the faculty member that was giving us the lecture was like, oh, this is the best published data that we have for any medication for a mental illness. And I got really excited, actually. It was called the STAR-D trial, which is, SSRIs for depression. And he gives all the data, and then he's like, so I can't remember what the follow-up was, like 1 year after or something. And he was like, so after, all the, double blind crossover placebo, yada, yada, he was like, and so with SSRIs, about 1/3 of people no longer had depression. Like, I remember my heart sank. I'm like, are you joking with me? I'm like, 1/3. And that's the best we've got. And then he was like, placebo, he's like, you have about 19% no longer have depression. So then my heart really sank. I'm like, the best we've got is 10% better than placebo. And it really, like, I'm laughing right now, but it was a very challenging time in my life. And I considered dropping out. And I was like, so as Michael mentioned, I have an MD and a PhD, so which basically means I went to a lot of school. So by that time, I had gone to school and training for 15 straight years after high school. And it was the first time it hit me where I was like, I think I really made a big mistake. And then I was like, what do I do now? I'm 32 at that point. I'm like, I've already like spent these years. I'm in financial debt. I'm like, what did I do? So I actually entered a pretty deep depression after that. And I was suicidal. And another thing that I often share is that I was raised Jehovah's Witness. And so I left the church when I was 15. But I mention that because that plus, the 80s DARE program by the Reagans and the Say No to Drugs. Like at 32, I had smoked pot about 5 times. 2 times I ended up in the ER thinking I had a heart attack with a panic attack. So like that's as extensive as my drug experience had ever gotten. Obviously, this was before I had long hair and piercings and jewelry. Like I was a pretty straight edge doctor. So yeah, and then so I actually, in my initial anxiety, I actually decided to apply to business school. I was going to drop out and work in like management consulting was my initial plan. And interestingly, my childhood best friend at the time, or he's still my childhood best friend. We've known each other since we were like 9 years old. He had decided to go back to school. So he was in his first year of college, taking physics. Well, the identical time that I was doing this, and he was living in California, I was in Boston. And he ended up dating his physics tutor who introduced him to a psychedelic called DMT, which probably many of you guys are familiar with here. And so he started telling me about, we would catch up a couple times. So he's like, oh my God, I tried this thing called DMT and you've got to try it. And I'm like, are you crazy? Like, what's wrong with you? These are like addictive drugs, they're dangerous. But he kept like pushing. He's like, oh, DMT. And then after about 6 months, he was like, yeah, he's like, they used to do research on this in the 60s and it used to help. And I'm like, no, that's not true. And then I went to like our search engine called PubMed. And lo and behold, I'm like, oh my God, like he's right. There was all this research. And so anyway, I'm going through this like depressive episode thinking I'm going to drop out. He's telling me about this stuff. And he's like, yeah, he's like, people are doing research on this right now. And then I was like, oh my God, like that's true. And it's like, that's like really when the big synchronicities in my life started happening. So I was at Harvard, as I mentioned, and it was interesting because then in 2012, there was only really 2 research universities, right? It was really like NYU and Hopkins at that point doing psychedelic research. But interestingly, at Harvard, there was a guy who about a decade before that named John Halpern. He is a psychiatrist. He had done research on psychedelics, but he stopped. As this is happening, he's working in the office right next door to me. And we always used to talk, like the residents used to like make fun of him. We're like, yeah, that's a crazy guy that used to do research on psychedelics. So after working next door to him for 6 months, I like knocked on his door after like watching like I think it was like a Terrence McKenna YouTube video. And I'm like, John, I'm like, can I talk to you about this psychedelic stuff? And he's like, yeah, of course. And then we started chatting and yeah, eventually I then flew back during a vacation to California with the intent to smoke DMT with my friend Chris. And I flew out there. It was a 2-week vacation. It came time. I had like the pipe lit in front of me and then I chickened out. And so I like flew back to Boston. Yeah, and then like 6 months after that. So I think I was like 34 by the time I tried. It was like 2 years later. Yeah, I flew back again to California, tried it, and I was like, oh my God. Like, again, I wasn't religious at that point. I was like, I'm atheist, agnostic. And again, this whole evolutionary thing and science that I had been sold on. But I remember a few things from that DMT experience. I was like, I had been there before. it was waiting for me. And the thought that it felt more real than anything, like it felt more real than real. That was like the phrase that was always in my head. So then I flew back to Boston after that vacation, and then I like knocked on John's door again. I'm like, oh my God, I like tried DMT last week, and like it's life changing. I want to like get involved in the research. And then he was great. And then so by then he's like, yeah, he's like, you should go meet my buddy. He's like, he lives down the street. He does research on psychedelics. And I'm like, yeah, I'll go meet your friend. Anyway, his friend ended up being Rick Doblin. Like Rick lives in Boston. And so Rick was like the first guy I met in the community. And so yeah, at that time it was really just like, I don't know, I didn't know anyone else in the community except for him. So like after work, sometimes I would just go to his house. He taught me how to smoke pot. Like one day, like I just like smoked too much. So Rick is open about his pot use, but like he smokes out of a bong. And like, again, I'm just like former Jehovah's Witness that used to just smoke pot and ended up in an ER. And then, yeah, one day I like smoked out of his bong a few times, and I had no idea that like the difference between like a bong and a joint. So like, anyway, it was really strong, as most of you guys know. And like, I ended up going into this like existential panic attack, and he broke out his little radio and like played music for me. He's like, oh, just breathe. And like, and I remember telling him like that eventually really helped me in my future psychedelic experiences. So anyway, that was like my intro to psychedelics.
Wow.
And in 2014, I like took the MAPS training, and which at that time was in person. And so I got to meet like Michael and Annie Mithofer and got to know the community a little bit better. And by then, like, again, really after that DMT experience, I'm like, there's, you know, this is my calling. This is why I ended up as a psychiatrist. I'm going to dedicate my life to that. You know, in the few years that ensued in that, I'm pretty open at this point about my personal psychedelic use. Like, it was a lot of running into trouble. Like, I did not know anyone, you know, none of my friends, you know, did psychedelics. At that time, it would have been scary to like tell my coworkers and maybe my superiors that I was trying. So like, it was a lot of trial and error by myself. Yeah, and I tell people like my first psychedelic was DMT. My first 100 psychedelics were DMT, and it wasn't until later that I entered into other things like mushrooms and MDMA and ayahuasca eventually. So yeah, and then yeah, it's interesting because like I think when I first, you know, decided to be a psychiatrist, you know, I really wanted to be a researcher at a university the rest of my career. Researching new antidepressants, like that was my calling. And so, you know, again, and I didn't have a spiritual connection at that time. And just, you know, not too long after starting, I just really, it's almost like as if the foundation of my spirituality, which was Jehovah's Witness, actually, I ended up feeling like very grateful for it, because I'm like, that at least allowed me as a child to have this connection to God and to spirit. And so, yeah, it's just just, you know, I'm very appreciative and in awe all the time. I think that's like the thing that I feel like is most consistent in my life as it unfolds, is the awe and wonder for this experience that we're having. You know, I don't say it's like only getting more joyous. It's joy is a part of it, sadness is a part of it, fear is a part of it. But yeah, I'm just more and more like just in awe of this entire thing that we're in. And so yeah, lastly, just to share, and then so it was around that same time, 2014, where I was really interested in psychedelics. But at that time, I noticed that it was really just focused on mental health and psychiatry. And I had started getting involved in holotropic breath work and body work. And then I started realizing like, wow, I think, I'm like, I know that it's really this mind-body connection is very real. I think physical forms of suffering, including autoimmune illness, pain, etc., is actually probably very much connected to the psyche or spiritual suffering. And so yeah, I decided at that point, or I had this idea at that time, I really wanted to focus on fibromyalgia and do that study, because it's this illness. It's a form of suffering, actually. I don't want to call it illness. That it's an expression, I think, of pain that sort of bridges the mind and the body. It was something that was not very well studied. It did not have a good treatment. So it felt like this nice bridge between, you know, psychiatry and the rest of medicine. And so, yeah, I sort of didn't have the know-how or all the enthusiasm for pursuing the project. And then I was talking to Rick about this. I can't remember when it was, maybe around just before COVID, and he had mentioned that he had spoken to a doctor at Burning Man, I think, about her interest in chronic pain, and so he ended up connecting Devon and I, and so that ended up giving the project enough energy to where we decided to pursue it. So that kind of brings us to today.
All right. Well, yeah, that's quite a story. I can totally relate to your Jehovah's Witness. I was raised LDS in the Mormon Church, so until I was about 16, and then my older brother came out as gay, and you know how their stance is on that. It's like you should ostracize them, and my parents were cool enough and loved their children enough that they chose him over their religion. So that's kind of, but my ideas of substances and different drugs was very like formed by that experience as a child. And I was very like, oh, I can't do this, don't drink, don't smoke, and wasn't necessarily a bad way to be raised, but it definitely influenced, like, starting to try different drugs to see if they would help with the chronic pain. It was definitely like something that I had to like think through and overcome. So I can definitely relate to that. So can one or both of you tell us about your new project with using MDMA for fibromyalgia pain, and how does that work, and have you even started it yet, or is it just in the beginning process?
Yeah, we are just in the beginning process. We have MAPS approval as far as our idea as an investigator-initiated trial. So we've had conversations with Michael Mitoffer and Rick and others, and those in MAPS that approve these ideas for as sound projects for them to provide MDMA to investigate. And we have been working on protocol writing, and that's essentially, we are in the protocol synopsis phase, really solidifying our outcome measures and sort of the early gestation of it. Our timeline is to be treating our first participant by late summer kind of next year. For anyone who knows research, it tends to move quite slowly. There's a lot of regulatory steps, especially with a scheduled substance like MDMA. But again, the idea has been gestating for both Will and I for quite some time, and it was really fortuitous that we were brought together by Rick to team up. It feels like a really great collaboration, and we really don't know the how, or even if, scientifically speaking, MDMA assisted psychotherapy is going to be helpful in the treatment of fibromyalgia. Certainly, we both hypothesize that one day we will know that for sure in terms of empirical data. Our study is very much an exploratory study. So we're not trying to prove efficacy. We don't have a placebo arm where people are getting a sham treatment. It's really just about enrolling a small number of participants. 12 is, I think, our number right now. We'll see. And kind of like proof of concept and just learning. And we endeavor to collect outcome measures, both quantitatively in terms of relevant symptom measurements for people with fibro, but also qualitatively so that we can hear people's stories and learn from that. I know, there's yourself, Michael, and I actually had a conversation with another person today who just learned about the work Will and I are up to, who her fibromyalgia essentially disappeared the next day after a session with MDMA that she came to on her journey. And it's kind of, these types of spontaneous healings and such are definitely well documented in the history of all sorts of different conditions. But it's certainly inspiring to me to know that these stories exist, and therefore I think really important to ask these questions. And I think we're really, I feel so resonant with people science. They're the folks that are really supporting our research. They'll be supporting the fundraising we'll be doing for the research. They're supporting us in the protocol writing and all of the technicalities, because, Will and I are first and foremost clinicians, and just entering into clinical research, both of us. And the vision of people science is really to help clinicians like us and the people ask the questions that are relevant to clinicians and their practices and the people they're serving. So I really think it's a wonderful vision and mission. So it feels really great to be working with Will and Belinda of People Science as well in this project. Yeah, I'll stop there. Over
Cool.
to you, Will.
Yeah, I mean, I kind of like Devon was saying, it's like again, it's a scientific term or medical term, proof of concept, but it's sort of to show that hopefully that it has an effect. I have a strong bias that it's going to show an effect, but a couple of things is that, in a way, this is to like demonstrate to the medical community that it can be done. Because usually what happens after, say, like MDMA gets approved for PTSD, then in theory, doctors can use it what's called off-label. And so, or can study it outright in these different areas. And I think, what I would hope to inspire is, researchers, whether they're in or out of universities, to then start going for autoimmune illnesses, psoriasis, multiple sclerosis, etc. But I also want to emphasize, and I sense that Devon would agree with this next thing I'm going to say, but I don't want to put words in her mouth. Even though I'm a physician, and I love what MAPS is doing, the medicalization. I love especially what Oregon has spearheaded in terms of decriminalization. I do think that the number of stories that I've heard also from people firsthand that have had pain disorders that either find incredible relief during a psychedelic experience, but many who find relief for some time after, if not permanent, is huge. I think having the guidance of trained therapists or people is helpful, but I don't think it's the only way to pursue healing with psychedelics. I think people should have the freedom to explore themselves, sit for each other, and do this in community, which I really love what Oregon has done. So I just wanted to make sure I share that as a physician.
Cool, thank you. Yeah, that's really awesome, and you definitely please keep us updated when you get your results, and love to share those and hear about it. I know that for myself, at my worst point, before I started working with psychedelics, my physical pain and my emotional pain, mental pain was very intertwined. One would set the other off and vice versa. And they became like this reverb effect of, this looping, amplifying effect every time it would go around in my head, the rumination, the pain would set off, this emotion, and that emotion would run out of control, and it would aggravate the pain, and definitely raised my level of suffering. And it was really through working with psychedelics that I was able to kind of pull those two apart, to where I can look at the pain more objectively now without it triggering all this flood of negative, awful emotions that really kind of kept me in that bad place. So can you kind of tell us a little bit about the connections between that you know of as physicians and psychiatrists between physical and emotional pain, how they influence each other, and how psychedelics kind of help with that?
Sure. I think Devon is much more an expert in a focus on pain, so I'll let her take this one. Okay.
Yeah. Well, I would, start off by saying that it's a field where we're continuously learning. And there's some really cool research with functional neuroimaging, looking at the brains of people who experience chronic pain. and people who experience, chronic depression and other conditions, and start seeing, similarities in some of the ways that functional connections in overlapping regions of the brain, whether we're talking about psychological suffering or physical pain. So, there's this concept of total pain as well, where, whether it's physical pain, emotional or psychological pain, or even, a more existential and spiritual dimension of pain, they're all part and parcel, and ultimately, I think it's very hard to tease them apart, because we are our moment to moment experience is continuously emergent, and there's so many contingencies in our perception of what is in a given moment, and also what we're looking for in a given moment. And what we're looking for in a given moment is influenced by all the moments previously, and we develop perceptual biases and cognitive biases, and which essentially just means like we see what we look for. And that can become a real problem when our experience in life is a lot of suffering, that the world isn't safe, or relationships aren't safe, people aren't safe, you name it, different experiences, and that can really influence our expectations, which then continues to shape our experience. And it's hard to get out of that. It's hard to, and I think that's some of the promise of psychedelics, really, is like very much an experiential, almost like a reset button, and ability to perceive oneself and one's relationship to life and everything from a very different perspective than what we've known before. And but to come back to pain and different types of physical and psychological and emotional suffering, we do know, in chronic pain management, the best practice is actually taking a biopsychosocial approach. So this fellow Engel outlined the biopsychosocial model of illness some time ago, and I remember it coming across my radar in medicine when I was studying medicine. I honestly don't see it applied that much in where the rubber hits the road in our medical system, but it's really about recognizing that the emergence and the experience of illness is this overlap between our biology and our predispositions or vulnerabilities and factors of resilience in our physical system, as well as our psychological framework and those things I spoke to just a moment ago, how we were perceiving ourselves and others, and then our the social realm, which speaks to our relationships and how we're embedded, and how much support we have and who our community is. And the one of the great teachers that I listened to, the Buddha, he said, the spiritual friendship is the whole of the holy life. And it's really just pointing to this fact that the people we're most around influence us tremendously too. And so there's these social, these psychological and biological factors that all overlap. And so in treating chronic pain, to address all of those is really the gold standard, and what we ought to be doing in interdisciplinary chronic pain clinics. So recognizing things like childhood adversity, adverse childhood experiences. There's a lot of research on that and how that influences the propensity to develop pain, chronic pain later in one's life, along with a lot of other conditions. So I think we were chatting about this actually, Michael, just before we started the session tonight, about how with chronic pain, it seems like a key is about helping and facilitating people to learn to shift their relationship to their experience of pain, and to shift their ideas and maybe fixed beliefs about their pain. Because when we do that, it opens up doorways to experience ourselves and our experience differently. And I think psychedelics can play a pretty powerful role in that process. Oh, yeah.
Yeah, I was very adversarial toward my pain, like we talked about. I was just constantly angry at it, sending hatred toward it, frustrated by it. I mean, everything you can name, including, you know, things like feeling shame because I couldn't keep up with coworkers, or feeling shame that I couldn't wrestle with my son that night because I was in pain, or something like that. And after working with the psychedelics and meditation and everything, it really flipped that narrative to where, you know, I realized that I was just directing all this negative energy back into myself. And I don't see it as this invader into my body anymore. And I don't send those hateful messages to it and feel those emotions toward it like that anymore. And that's made like such a huge difference. It seems like it's so simple. And I know people are really adverse to the accepting their pain. But it's been such a huge like shifting thing for me. Can you talk a little about pain acceptance and how that's different from, like, when people hear acceptance, they think, oh, that's kind of giving up. And because that's what I thought at first. I was very like, I heard that word acceptance and I'm like, screw you. I'm not accepting it. I'm going to beat it. You know, that kind of attitude, and it's not going to conquer me. I'm going to, you know, crush it out.
Will, did you want to
Sure.
say anything on that?
I
Yeah.
could say a little bit about that. Like, it'll be a little bit, I think about what I feel like I know solidly, and then something else that I don't feel as solidly. You know, I think about like emotional pain as opposed to physical pain. I think there's relationships between the two, but with emotional pain, you know, it was really through the personal work myself in psychotherapy and my other healing modalities that I went through myself, or I'm still going through, and also the work with my clients. Like, what I started realizing is that pain, and this is obviously not what we're taught at all in psychiatry training. I started realizing that painful emotions, let's say, and the three I usually work with that people consider painful are sadness, fear, and shame, right? Which were things I struggled with for a large part of my life. And I used to like many people say, I want to get rid of these, like these are ruining my life, like the thoughts that are creating these, like they're terrible. But what I started realizing after some time is that, in a way, like an analogy that I often use is that of a sailboat. You know, if we have a calling, if we have a purpose in life, and say we can demonstrate that visually by saying, okay, I'm going to sail my sailboat from Southampton in England to New York, and that's like the destination I'm meant to sail on. But culture, religion, family, media, right, alters our path, right? And it says, okay, actually no, shoot for making a lot of money, or shoot for a prestigious career, or shoot for the highest academic positions, right? And if those things are not in line with our calling, it's like I think about pain, again, emotional pain, as like our GPS system, which actually says, you know, if I've then directed my sailboat to Miami, it's like the thing that kept saying, okay, well, you know, make a U-turn, turn left. And it's like that voice on our GPS that will stay there to get us back on track. And you know, we can try to silence that voice. We can try to silence that voice with alcohol, or we can, you know, with gambling, or with any form of addiction, or we can also numb that signal with antidepressants or benzos or opiates. You know, so it's things. I'm not saying they're just addictive behaviors, like even the prescribing medication that doctors give numb these signals, right? And if we numb those signals, we can then stay on that altered course for the rest of our life, right? But what we're finding is that's why I would say that the traditional psychiatry approach has not worked, because, you know, the problem isn't the signal coming out, it's the how we're living our life. And so once I started really using that approach, it's like people started getting a lot better. And I see psychedelics as simply as a tool within redirecting us in our sort of life path and our calling. So, and where it's harder for me a bit right now is with physical pain, but my hypothesis and a lot of the reading out there is that there is a similar overlap with it. At least like there's, as people work through a lot of their, psychological struggles or their life direction, is that again, we sometimes see people that whose physical pain who they've had for a long time go away. I'm also very aware that we are, physical beings, we have bodies, we do age, we die. And so I'm in a little bit of like an exploratory mode right now of, how much of physical pain can we heal or change with psychedelics? And I think it's going to vary a bit depending on the person. If someone has the majority of their pain that's related to emotions and the psyche, I think we could probably get rid of, for some people, all of it. I think there's other people that say, I don't know, if they were in a car accident and they had multiple fractured vertebrae, where there's more of a physical reason perhaps for their pain. I still think in those situations we can change the relationship to the pain and how people think about it and feel about it, which I think so in all cases I think we can improve, but the extent at which we improve, I think will depend a little bit. So that's my view on pain, that it's more this guidepost to get us back on track.
Cool, thank you. Yeah, what you were saying about having purpose kind of made me think of Viktor Frankl and his, he said you need two things to have to get through life, and that's meaning and purpose. And if you have those two things, then you can overcome any kind of adversity. And that's kind of like why I was in such a bad place after I wasn't able to work anymore. I felt like my meaning and purpose, I had to find those again. And so it was quite a struggle, but yeah. Thank you very much.
I could definitely chime in too, Michael, on
Yeah.
that same kind of track, because a lot of the things Will said also sparked some things in me too.
Me too, yeah.
I also resonate with our bodies giving us messages and signals, and it's very much contrary to kind of the Western biomedical paradigm of how we approach ourselves and our bodies, especially. I would say that the paradigm almost teaches us to be afraid of our bodies, that they might betray us, and to also take this kind of adversarial approach in kind of conquering any betrayal or invasion that may happen in terms of our health status. And you hear that through language like the war on cancer and war on this or that. And it's one of the fundamental perspectives that I would love to see shift is around actually honoring the wisdom of our bodies and honoring the messages that they give, even though we may not like them, and even though those messages may be very excruciatingly painful, but that this is not something to be in fight with or in this adversarial battle with. In fact, that doesn't lead to integration and healing in my perspective. Actually, healing is quite the opposite. And to come back to your question about acceptance and what it like, this acceptance of pain and what is that? I would say acceptance doesn't mean condoning something. It also doesn't mean agreeing with something or even liking something. But it can be allowing experience to be what it is right now, with less of the suffering that comes when we're in a stance of resistance to it in our moment to moment experience. And until we try it, we don't know, and so in teaching the mindfulness-based stress reduction program, that's one of the big things is, inviting people to explore and even just to tiptoe towards sensations that they might otherwise try to erase from their experience or distract from. And in doing so, it's kind of like this, oh, actually, maybe I was really fearing that what might happen if I did that. But when I really do, my experience is very different than what I thought it might be. And, there's also this concept of equanimity that is developed through mindfulness practice of our capacity to meet experience, whether pleasant or unpleasant or painful, from sort of like a centered place, instead of getting knocked around so much about what we like and what we don't like. And that really builds resilience and strength in the face of all the different things that can fly at us in our in our lives, including pain we might experience. And I think it's also, you know, what we know perpetuates PTSD. One of the factors that perpetuates PTSD is experiential avoidance. And I think there's argument there within chronic pain as well, that this experiential avoidance, so avoidance of the things that trigger my PTSD symptoms, or avoidance of the pain I'm experiencing, it activates the fear centers in our brain, and one of those being the amygdala. You might have heard of that part of the brain. It's like our alarm, smoke detector, alarm for threat. And our brains are wired to interpret pain as a threat signal. But when pain becomes chronic, it's actually, there can just be this sort of signals gone awry, where there's this continuous threat perception, which actually amplifies pain signals. We do know that from neuroimaging, that the more keyed up and on edge and in fear that we are, it actually increases our pain perception. So I think that's also a really interesting connection there between the mind and body. And pain perception is very complex, is partly why I'm so fascinated by it. There's so many different ways where the signals of pain from, you know, if you pinch me down here, what happens, and how I actually perceive it. It's not just A to B kind of simple wiring. There's a lot going on. So yeah, that's just more about why I'm excited to be working with Will and doing this research.
Cool. Yeah, I saw another video of yours. You were talking about trauma, and I often wonder, you know, the traumatic things that like I didn't pick up on as a child that may have like led into chronic pain later in life. I remember like I was very stressed out in school as a child. I hated school, like elementary school. It was like, you know, I would rather be anywhere but there. But I remember, you know, my head would get stuck to one side because I would get such bad muscle spasms in my neck that I couldn't lift my head up, and I'd have to leave school and go get like a muscle relaxant so I could just straighten my head out. And you know, it's kind of like that was like a very kind of, I look back and that was a very like physical reaction to the emotional kind of pain that I was going through at that time, the anxieties of school or the stress of it. So yeah, I really, I know that there's a lot out there about trauma and how that influences inflammation and chronic illnesses. Do you have anything to add in that kind of realm, either you or Will?
I think just in your example there of, you know, the tension in your neck, it's very basic. When we are anxious, or when we're not well supported by the humans around us, we tense. It's part of our innate response is building of muscle tension, and chronic muscle tension over a period of enduring adversity is absolutely going to lead to stiffness and holding in the fascia and these very like physical systems of our body. So, you know, it is really that simple, that connection there. And another thing I wanted to say too is related to what we're talking about is that, you know, I became a physician. Part of why I did too was to have all the tools in my tool belt. And we've been talking about, you know, how SSRIs or pain meds or benzos and things, you know, may not be such great tools, but also don't want to speak in a disparaging way about them, because, you know, myself and many patients that I've helped have used those tools for a period of time to kind of get a little bit of a boost. It's like putting a cast on your fracture, where these tools can be absolutely appropriate. So I don't want anyone to come away from this thinking that we're saying those tools are not good and that psychedelics are the replacement. In fact, it's about really what's right for a given person in their specific context. And I think in many cases, numbing our pain and giving ourselves a break is very much the compassionate and right thing to do. So I just wanted to say that as well.
Yeah, it's yeah, I have been on, you know, pain meds off and on for quite a few years, and yeah, I think the worst pain spiral that I got into was when the FDA released their recommendations for how to like limit pain medications or to like take people off of it, even though it didn't specifically say that. People started interpreting it that way and started like tapering people off that really were stable. And it was very frustrating.
That same thing happened in Canada in the last 5-10 years. And it was devastating to see the impact of that, when really it's not an appropriate thing to be asking doctors to do, when what other solutions is our healthcare system offering in the place of that? And when there aren't any, that is not okay. It's not ethical.
Right. And too, at that same time, that kind of started a bigger spiral, like socioeconomically, because my job in the US is tied to my healthcare. So where I'm missing more work because I'm ill or in pain, I'm losing money. I'm not able to pay my medical bills. I'm, worried about losing my insurance. And that's causing me more stress. It's certainly not helping the pain. And I've often said that, chronic pain itself is a traumatic thing. We were talking about that with, another group here, that just being in chronic pain is a traumatic experience. And I think it almost causes PTSD over time, kind of thing. And that's where I think psychedelics are a very helpful tool to kind of get that reset that can be really helpful. Of course, psychedelics are not a magic bullet. We try to like reinforce that in our group here, that there's still a lot of heavy lifting and work that you have to do yourself, that a lot of people just want to like take a pill and feel better, and we would all like that, but it's really another tool to kind of help you move forward and get out of that stuck spot. I always say that I felt like I was just on a skipping record, and every time the needle went around, the groove dug deeper, and I couldn't get out of that groove because it kept getting deeper and deeper. And the psychedelics bumped that needle and moved it to the next song, and then I was able to move forward and not have to rely on keep taking the psychedelics. So
yeah, absolutely.
So can you kind of talk a little bit about the differences specifically with certain medications, like how people react with MDMA for pain and trauma therapy versus like LSD, psilocybin, or ketamine? I know, Will, you offer ketamine therapy for psychiatric issues, or you did. Is there certain ones that work better for certain things like trauma or chronic pain that you've seen in the literature?
So in terms of published literature and psychedelics and pain, I don't even know if there is anything. I know Devon can probably talk, if she wants to talk about a little bit of the data that she has analyzed with MAPS. Maybe I'll say a little bit just anecdotally is that, well, yeah, she'll talk about what this wonderful data that she has been taking a look at. You mentioned ketamine, Michael. So it's interesting because I am working with a company. I'm an advisor to Bexon, which is one of the things that in the introduction that you shared. And as maybe people who definitely have experience with ketamine in the group are probably aware, right? Ketamine at high doses ketamine initially was an anesthetic, right? So it's potential for complete dissociation, right? That's why we're able to, in theory, inject people, out on a war zone or at a car accident site who are, have a lot of physical trauma, inject somebody, and within a couple of minutes, you could be doing surgery. So meaning that the mind and body is completely dissociated, right? At more subtle doses, you can get interesting or even potential therapeutic effects, right? With with therapy or out dancing for fun or something. So it's interesting because to me, there's this interesting spot of, you have this gradient of in the body to completely out of the body. And so there is a potential for the easing of pain, or in theory, if you can like just get it right, to completely remove the pain. I mean, I would not see this as an approach that would be getting to the root of the issue. But I mentioned Bexen because it is a company, again, that I'm involved in, that we have this interesting approach of using, we're sort of combining a developed and improved version of like an insulin pump. So, insulin now, you used to have to like inject with a needle and check your blood sugars, but in many places now you can buy these little pumps or get prescribed a pump that can sort of more throughout the day monitor and provide insulin at a more natural state, like the body would for people that have diabetes or severe diabetes. So this pump, what we're hoping is going to be able to inject very low amounts of ketamine that probably aren't really achievable at that sort of steady state outside of like IV, right? And an IV treatment for pain with ketamine isn't really something that's useful, right? Because you can't get around the world. You're not going to be able to drive with an IV. So potentially, we're hoping that this could help people that have chronic pain, especially who are dependent and need, opiates even, right? Because we don't really have a good solution to help people to come off of opiates, right? And so it's an area of interest of research of mine. And again, this company is developing it. Again, I don't present it as a getting rid of the roots, but it is a potential to help alleviate and then perhaps have people do the work, that is able to get more at the root level. So that's the only thing I'm able to contribute. And it's not published yet. It is public that we're working on that, but maybe Devon can say a bit about her work.
Yeah, Devon.
Yeah, thanks. Ketamine's another one. At our pain clinic, we have infusion model for treating pain with ketamine. And there's this kind of medical model. Ketamine has tremendous physiological effects itself, like just the drug alone, that we're discovering not only for pain, but also in depression and potentially other conditions. There's a lot of research in depression just with the drug alone. And then there's taking that medication and doing the more psychedelic assisted psychotherapy model, where it's an adjunct to a psychotherapeutic process, be that through IV or lozenges or intranasal or intramuscular, different routes of administration, where, it's actually, and Will, as you mentioned, you're doing this work to get at more at those roots. So it's a beautiful molecule because it has, very clear benefits by itself, and also this potential as an adjunct to psychotherapy that I think is quite tremendous. And it's an interesting psychedelic. It's a dissociative anesthetic, and it's very unique in its mechanism from others. We do have literature on LSD, and some very preliminary literature on psilocybin, some more classical psychedelics in the application of pain. Some research that was done some time ago, and I know that there's a group at UCSF that are looking at the application of classical psychedelics for some pretty severe and more rare pain conditions like complex regional pain syndrome and cluster headaches specifically. And I think that's going to be really interesting to see. And there's aspects of the action of classical psychedelics. There are anti-inflammatory actions of classical psychedelics. There are just the neuroplasticity that they provide, which also ketamine does as well as MDMA, but in slightly different ways. So that research is really starting and moving forward. I think people recognize that chronic pain is such a huge burden of illness. There's so many people here in Canada. It's 1 in 5 people experience chronic pain in their life. So we need to be looking for new solutions and innovative solutions. And then when it comes to MDMA, that's where there hasn't been really any research that I'm aware of until just very recently with our project. And then Will mentioned that I did get access to some data from one arm of the PTSD research that MAPS is doing. So 35 participants data, where they added an additional kind of exploratory data point on using something called a chronic pain grade scale, or CPGS. So it's just one of these validated measurement tools for chronic pain. None of them are perfect. They all have their flaws and such, but so we analyzed that data and we're writing up the paper right now. But what was really exciting and encouraging to see is that when we clustered the participants into kind of low, medium, and high PTSD severity, as well as low, medium, and high pain severity, which, by the way, the low one was still quite severe. So it's just stratifying within already a population sample of severe PTSD. So it's just sort of relative to each other in the population sample. We saw that the medium, the mid cluster of the PTSD symptom folks had the highest pain scores at the start of the study. 84% of the participants had chronic pain, which speaks very much to the overlay between PTSD and chronic pain as well, and potentially reinforcing different sort of aspects of those two conditions. And then after the participants went through 3 MDMA assisted psychotherapy sessions to treat PTSD, no mention of treating their pain. This was just an accessory measure that was being done. We saw that there was a trend in all 3 clusters, but that middle cluster, there was a statistically significant change in their chronic pain grade scale scores. So that was really, it's not a huge sample size, but it's certainly part of the rationale for further exploration of MDMA assisted psychotherapy in treating chronic pain.
Cool. Yeah, I had a question, from Jeff that kind of asked about that. He wanted to know why MDMA and what's your hypothesis on that. So that kind of explains that part of it. And he also wanted to know what your definition of fibromyalgia is as doctors. How do you conceptualize it as a condition?
I'll speak to that briefly because I know I see that.
Yeah, sure.
Yeah, I know I see it in my practice a lot, and it's not as much a part of Will's psychiatric practice. So, fibromyalgia is the American College of Rheumatology criteria, which is a widespread pain index and the symptom severity scale. So that's the gold standard for the diagnosis of fibro. So it's a combination of the number of locations in both sides and different areas of the body where pain is experienced. It used to be you'd actually have to examine and push on tender points, but that's actually not part of the latest update in the diagnostic criteria. It's really just asking, do you experience pain in these different parts? And if there's a certain number, you get a score. And then the symptom severity scale speaks to, how the pain is impacting your life in different ways, as well as fatigue symptoms and other symptoms that are very much part and parcel of fibromyalgia syndrome. There's so much overlap with chronic fatigue syndrome and other central sensitivity syndromes like tension headaches, irritable bowel syndrome, dermatological conditions, a number of things. So it's really the combination of those two things that's technically the definition of fibro, but it's also, historically in medicine has been poo-pooed and still is by doctors. They, that's not real, or that's not a real condition or something. And I'm sorry for anyone who's experienced that attitude or that false belief by a physician, because it's simply not true. It's a real condition. And there's some interesting information about the role of mitochondria and energy production and inflammation and all kinds of other things that we're exploring and discovering about the pathology of fibro. So yeah, that's
cool. Thank you, Jeff. Did that answer the question that you had? Did you want to add to that? You good?
No, that was very helpful. Thank you. I think, I was just kind of curious, how you sort of conceptualize. It feels like there's a lot of new data out there, and just kind of curious about how you're conceptualizing and then how you're sort of visualizing that work translating into the research as well. But it sounds like you all are still in sort of a figuring it out phase.
Yeah, I mean, I think we'll, as part of our, inclusion criteria, people will need to satisfy those diagnostic criteria for the condition. But like everything, no set of diagnostic criteria are completely, inclusive of all the experiences a person may have. Yeah, with fibro.
Yeah. And has there been any research, or do you have a hypothesis for your research now that is kind of approaching how MDMA might impact? Like, is it on like sort of a physiological level, or is it I know you've talked about this a little bit already, but or more on a mental emotional level, and then that helps with coping, or that might even help somebody experience less pain?
Will, do you want to?
Yeah, I mean, my hypothesis is more along the lines of mental, emotional, but also like spiritual, energetic. I know we didn't get much into that, but I think but I also like real evidence for it would be, say, in the PTSD study, or I don't think anything that if we think it's a pharmacologic thing, I would imagine that you would take MDMA or whatever psychedelic, and it would leave for that period of time, but then it would come back when the drug has washed out, right? I think if it was purely a molecular impact, I would say. So to me, I feel that there's it's multi-layered, and I don't know, I'm getting really into like energetic and spiritual and matter in the body and sort of stuff. So but yeah, I think it's going to be I mean, I don't know if science will catch up to the point where it can show evidence for spiritual energetic work, but that's what gets me most excited about this.
Yeah, and I would add too that the fact that the healing of PTSD was correlated with reduction in pain symptoms. Like I mentioned earlier, that fear system of our brain that's very, very highly active in PTSD, and also when we have this sort of intrinsic threat response to our experience of pain happening, that's perpetuating and amplifying our pain. If MDMA can help the fear center calm in the brain and help us really regulate our nervous system, perhaps in a way that we haven't experienced before, that is absolutely going to have an impact in our experience of pain. So it's very much a physical change in how our brain is wired and how our nervous system is operating that will help change our experience of pain, we think. I mean, we can't say anything fully conclusively, but really hypothesizing.
Great. Cool. Yeah, thank you very much. Question from Leslie. I was wondering if psychedelics can reverse the negative effects of long-term antidepressant use. Do you have any thoughts on that or heard anything on that? You don't have to make things up if you haven't.
Yeah, I mean, the answer is I don't know. Like I'm not sure even like what has been established as the long-term negative effects of antidepressants yet. I mean, I definitely believe that it is real and possible that, after taking antidepressants, there are long-term effects. So yeah, I just don't know. And I don't know if the science is at the point really where we know what that's all about right now.
Yeah.
Okay.
Yeah, I agree. There may be something out there, but I would just offer that our brains are plastic. They can be rewired, and when new conditions in the environment are established, we adapt. We have a tremendous innate impulse towards healing, and that can be remembered at any place along our healing journey. And I think that, I believe that operates on the different levels of our being, be it emotional, physical, psychological, and spiritual.
Cool. 2 questions here. Any word if Ibogaine works for pain? And then another one, do the participants in the fibro study also have to qualify for PTSD diagnosis? Will?
In terms of the second one, no, that's not. The plan is not to have people qualify for anything except for fibromyalgia. What was the other question?
Any word
Ibogaine.
Ibogaine?
Oh, Ibogaine
for pain.
I don't know. I mean, I don't think there's like, again, hard research evidence. My gut is that, again, because of the emotional, psychospiritual energy, like root of pain, is that I think for that, the pain that is not like, again, structural because of vertebrae fractures, etc. I would imagine that ibogaine could also be a very powerful, potentially a treatment for the what's underlying the pain.
Cool.
Yeah, and just to come back to that understanding of the complexity of pain perception, there are so many different little connections that happen from a pain signal to how we experience it in so many different levels of our central and peripheral nervous system. So I think that that's where there's so much to learn about how these different medicines may influence all the different places along those complex pathways that is ultimately sort of at the end of the day going to play a role in how we're experiencing pain and its intensity and severity and all of that.
Cool, thank you. Yeah, Evan had a quick question too. As someone who has never done any psychedelics, but who suffers from fibromyalgia and lupus related pain, where would one begin to introduce this as a healing modality? Fascinated and grateful for the amazing work you're all doing. Is there a way? I know that, in Oregon, they're trying to figure out how to introduce this, it's a whole other giant subject as far as like legal routes versus the non-legal routes.
Yeah, I mean, something that comes to mind for me is that, like, I think we've said this in many different ways, but maybe I'll say it also more directly, is that, I believe that the things that have led to us to feel pain, whether it's physical or emotional, lie for the most part within our physical body, or our, again, let's call it the energetic psychospiritual body that is related to each of us. And I also then believe that all of the mechanisms and the tools that are necessary to get us out of that also are completely within us. And that the psychedelics are simply like an opportunity to help the body do what it can already do, but it is certainly not, I like to say that psychedelics are neither sufficient nor necessary to do the healing work, but they're the most powerful tools that we have right now. Right. So in this frustrating time, which I really do, I mean, obviously it's frustrating right now that people are suffering from emotional pain, from physical pain. There's all this news, especially in the last year, about psychedelics and how great they are. And then, people are like emailing or calling people, and it's like, no, sorry, MDMA won't be legal until probably 2023 or 2024. And, it's going to be expensive for a while, etc. So it's a very frustrating time right now. I would also say at the same time that, I wouldn't say that means that that's when you can feel better. I do think there's steps that you can take. People have shared stories today about that. And, I would, one thing that I am, a fan of or an approach is microdosing, and I think like microdosing in combination with things that you're called to in terms of forms of healing work. For some people, if meditation is something very powerful for them, if their yoga practice is very powerful for them, if acupuncture is very powerful for them. I've heard of people in all of these areas that use microdosing and will go see their acupuncturist, or do microdosing and will go practice their yoga practice. So I would think of it as this, like, again, this potential accelerator of something you're already doing. I've never heard about microdosing and your physical therapy practice for your pain. These are things that I would, at low doses, and you guys have probably had, workshops or questions on microdosing here before, I imagine. It's just, it's very gentle. I tell people often, if you haven't tried anything, and this is obviously not me recommending it, as Michael said in the beginning, that if you take a microdose, meaning like a 10% or so dose of what's considered a full dose, it is magnitudes more gentle than having 4 or 5 drinks of alcohol, getting drunk and blacking out. But by the time we're our age, for most people, if you drink, like, it's so normal, right? Like, we know what drinking a few glasses of wine is going to be like. But really a microdose, like, and especially when you're starting out, you probably won't even feel it. So I tell people that with anything, if you're curious and you feel okay, then, and it's in a safe environment, like just start low and go slow and just test things out for yourself. I'm a big advocate of people, being in taking ownership over their healing process and exploring their consciousness in ways that they feel safe.
Cool. Yeah, just one quick thing. Thank you, Devon, for helping to answer some of the questions in the chat box. I appreciate that. Carolyn had a question. Is there a concern about the amphetamine in the medicine causing further dysregulation of the nervous system? Which is
I haven't seen that with PTSD. It makes sense to ask that question, but it hasn't been the experience with PTSD. It may temporarily, increase sympathetic drive, but the experience of MDMA is so much calming the fear centers in the brain that, and actually reduces pain and really helps people to feel connected and trusting and empathy and self-compassion and all these things that are so supportive to the healing process that it hasn't been there haven't been any negative side effects reported in hundreds of people who've experienced MDMA therapy now.
Great. Yeah, thank you. Dave, are there any PDFs for docs that people use for recording effects of microdosing? What questions to ask before and after? Does anyone out there have any PDF programs they like to use that they've been keeping track of things on?
A colleague of mine started an online tracking thing. It's it's like a people sourced. I gotta think for a minute what it was called again. It's escaping me right now. But look, I think James Fadiman has put some research out there, people sourced research around microdosing, and I can't think of it right now. But if I think of it, I'll share it with Michael and he can put it in the notes. I think.
Very good, thank you. So that's our time for this evening. Thank you both very, very much for coming and sharing your expertise and all your knowledge and empathy, and really appreciate it. And I wish we could talk longer. It would be cool, Will, to have conversations with you about spiritual side of things, and I would love to pick your brain more, Devon, about just the trauma related. And they were talking in the chat box about HSP. I know as a kid I was very HSP. That's part of why I didn't like school. So yeah, I wonder if that it all relates. It all seems like it all kind of ties together. So thank you very much, and thank you everyone for coming. I hope you got something from it, and please join us in the future. Sometimes we just have open forums and sometimes we have speakers. There are links in the chat box for ways you can volunteer and all kinds of stuff and donate. Thank you very much, and everyone have a good, happy weekend.
Thanks, everybody.